The gentleman from Augusta, Mr. Landis.
Mr. Speaker, I rise for the purpose of a point of personal privilege.
Gentleman, may proceed.
Thank you, Mr. Speaker. Mr. Speaker and ladies and gentlemen of the House, the gentleman from Colonial Heights, our majority leader, spelled out overall what the policy agenda would be for the Republican caucus. And the gentleman from Henrico just spoke earlier about our economic development plans and how we're going to provide more jobs for our citizens. Today, what I want to talk a little bit about on behalf of the caucus is our health care policies. And more importantly, how we're going to provide a better system and improve our system for our citizens. Health care is going to be an issue that is getting a lot of attention this session. It will also be something that we will hear a lot about in Washington. So what we want to do this year is build on the success we had from last year's session and do even more. First and foremost, we're going to reintroduce an idea that we had last year as part of our package that deals with direct primary care agreements. That is House Bill 2053, and we've tried to address the concerns that were expressed by many for that legislation last year, including the governor. We're also going to be looking at Medicaid reform. So let me just quickly review. I'm not going to rehash all the debate that we've had on this floor about Medicaid and whether we should or shouldn't expand. But suffice it to say, many of us still believe, and I think it's been proved out based on what's occurred with the Affordable Care Act, that we made the right decision not to expand Medicaid. Our current Medicaid program is generally unsustainable on the trajectory that we have currently. We learned just in November that Virginia will need to spend approximately $300 million this next biennium. We also learned through the JLARC report that shows basically our Medicaid program over a period of 10 years has grown nearly 9%, and at the same time, the Commonwealth's revenues have only grown at 1.3%. That's just not sustainable long term. So what are we going to do about that? Medicaid reform is something we've talked about and we started a number of years ago, but we really are going to follow up on that this session because of the JLARC report that many of my colleagues told me, as the majority leader said, we didn't need, wasn't necessary. We have audited, we've reviewed, we've investigated our Medicaid program time and time again. There wasn't anything new that we could find. We've done everything we could. Well, surprisingly, Mr. Speaker, we found through the JLARC report that there are 35 recommendations to reform and to improve our system. The JLARC report showed that we do have a broken system and we need to fix it. It revealed that Medicaid currently is leaving on the table $43 million. That is just unacceptable. Now, how are we going to work to improve our program? Based on the JLARC recommendations, we'll be looking to those recommendations and working with the staff from JLARC. There are four main sections of reform that we want to address. First of all is improving Virginia's cap on managed care organization profits. We're one of the few states that does not do that. We also want to improve the rate-setting process to ensure capitation rates are not higher than necessary. We want to look to incentivize our managed care organizations to serve more recipients at a lower cost in community settings. And last but not least, we want to improve the reliability and eligibility screenings for long-term services and supports. Now, Mr. Speaker, we're also going to look at our welfare system. So that's the second part of our agenda that we want to focus on. Unfortunately, the number of people dependent on food stamps has increased by 150% over the last 15 years. For every 2 new jobs created since 2001, nearly 3 people have been added to our food stamp program or rolls. So what are the legislative solutions to look at related to this? We have a number of bills that will have been introduced, and as you will see. House Bill 2305 that Delegate Orrock is carrying will tighten up Virginia's statewide work requirement. House Bill 2092 that Delegate LaRocque is carrying will do a cross-check with our lottery winners. In other words, we want to make sure that if you win the lottery and that you're on our program and you're no longer eligible, that you don't get the lottery and your food stamp benefits too. That's common sense. We also want to look at House Bill 2213 that Delegate O'Bannon is carrying that will lower the TANF time limit. And I know there's been some discussion about this, but let me remind the members that when that program was set up, it was a temporary program. It was not to be a permanent program assistance for individuals. So we want to look at instituting a 12-month lifetime limit. We also have House Bill 2207 that Delegate Robinson is carrying that will basically make sure that we are going to do an audit after 4 EBT cards are replaced. That is allowed by federal law. And we think that that will reduce the trafficking that unfortunately occurs in some cases regarding the EBT card. We also have House Bill 2208 that Delegate Pogge is carrying that will put on the cards, EBT cards, for the first time, a photograph of the head of household. Again, that will help reduce fraud related to the use of the cards. And last but not least, Mr. Speaker, this bill has not been introduced yet, but Delegate Head will be introducing legislation that will codify our SNAP eligibility requirements. We need to codify those requirements to prevent future governors from weakening the federal eligibility. And it will allow the legislature an opportunity in the future to discuss, debate, and change any of those eligibility requirements since they will be in the code. And Mr. Speaker, last but not least, there's another area that we're going to work on. I know you and many others have talked to us about the growing crisis that we have in the Commonwealth regarding opioid and heroin addiction. And both sides of the aisle have shown and expressed great concern over this. Other states of the United States are seeing this same crisis, and there's been many, many news reports related to this as well. So we'll be advancing legislation to prevent opioid and heroin addiction and provide the resources necessary to intervene for those currently addicted. The legislative proposals we have include House Bill 2161 that Delegate Pillion has, that will allow a collaboration between state agencies and our medical schools to include the safe use of opioids in pain treatment for our doctors, and the addiction risks that will be part of that curriculum. Delegate Pillion also has House Bill 2163 that will limit who is allowed to receive the Subutex drug. We also have House Bill 2167 that Delegate Pillion has, directing the Board of Medicine to look at emergency regulations related to dosing limits for opioids. And we also have House Bill 1845 that Delegate Cox will carry that will establish a pilot program for jails to use for the use of an addiction recovery program. And it would be similar to a program that's in Chesterfield County, the HARP program. So, Mr. Speaker and ladies and gentlemen of the House, in closing, I just want to say that we are going to be focused on common sense health care reforms that we can make this session. And hopefully, together we can do that so that we can provide a goal to not only this legislature, but for our citizens to solve the problems regarding health care in the Commonwealth. We want to make sure that they have a strong, quality health care system, and that we want to provide legislation that will move that agenda forward. I hope, Mr. Speaker, that both sides of the aisle can work together on all this legislation, and keep in mind that the best thing that we can do for the citizens is to provide for a strong and safe health care system. Thank you, Mr. Speaker.